Dr. Donovan Christie is the founder of Anwan Wellness Medical Center, PC, the Anwan Regenerative Center, and the Picture of Health Foundation since 2000. He is passionate about preventive medicine as the practice focuses on integrative and functional medicine, utilizing practice lifestyle interventions such as nutrition, exercise, spirituality, natural nutraceuticals, hormone replacement, stem cell, and platelet rich plasma therapy, detoxification, intravenous nutritional infusions, which is just IV therapy, chiropractic, massage therapy, and pellet therapy. Dr. Christie received his MD degree from Albert Einstein College of Medicine in New York and is board certified in internal medicine, pediatrics, and preventive and regenerative medicine. Please put your hands together for Dr. Donovan Christie.
All right, I'm going to have to talk loud because I don't have a mic set up. We're taking this broadcast, but I want to welcome you guys here. Thanks for taking out the time to come and learn about the state-of-the-art medicine. Many people have joint pains and as they grow older, and it's usually from the cartilage wearing out, wear and tear. So what we've done in regenerative medicine is to find a way that we can help the body to regenerate its native tissue. Not the orthopedic approach, which is to do a knee replacement or a shoulder replacement, but to get your body to heal itself. God gave us a body with amazing adaptability. We just have to focus those healing properties in the area where you want the healing. So what platelet rich plasma does, it utilizes your own tissue, your own blood tissue, to heal you. From joint pains, to arthritis, to tendinopathies. We are also using it for dermatological conditions. People with scarring in their face, or wrinkles, anything that's degenerated, you can actually regenerate with your own tissues. So this is big because, you've heard of stem cell. Stem cells are important. Stem cells are usually from your own body, but as you get older, your stem cell numbers go down. Your platelets don't go down. So as you get older, they'll recommend umbilical cord cells or amniotic fluid cells. So we do that as well, but this is focused talk on platelet-rich plasma from your own body, heal yourself, joint body. So dermatological conditions would be the acne treatments. It revives the skin, and I have pictures to show you. These are our patients. These are not paid actors. They are actual patients that we've treated, and we've gotten these types of results. Okay? So without further ado, I'm going to start. Put your thinking caps on. You're going to have a little bit of science, but the science is not that rigorous that you won't be able to follow. You know anything about blood? We've all had a cut, you know what blood is like. So I'm going to go through how your own blood can help heal you. So we're going to talk about platelets. I'm going to talk a little bit about how we prepare the blood, because it's not just blood that we take and put it in place. We have to concentrate it. And that's why it's called rich, platelet rich, because we've concentrated it, so it's rich, the plasma. And I talked about the uses of PRP, musculoskeletal. For sexual dysfunction, I was going to leave that for last, but it helps to enhance that as well. For women with incontinence, after having a couple of babies, they'll have a stress incontinence. The PRP can actually go in and tighten up that area around the urethra and help with leakage. And they're using it in dentistry for when they're putting in dental implants, so that implant could take, and you can't pretty much tell. All right, so here we are. These are platelets. So we get a little bit of blood in the human body. You have the blood here. We take a little bit out. Say about 20 tubes. No, about 6 to 8 tubes. Sometimes 9. And this is what it is. If we spin that blood down, it's going to separate into what we call the plasma and then the form elements, right? We don't need the form elements, we want the plasma. So we spin it again, and then we're going to have platelets here. And the blood part, we don't put the blood back in, we just use the platelets. We concentrate the platelets 5 to 10 times the normal concentration in the blood. That's what I call the elixir vitae. That's your body's own regenerative abilities. What is that? The phone ringing. Right? So, briefly, so the blood cells have these in it. The solutes have these. We don't use any of this. We primarily just use the platelets. So when you look at a platelet, what is a platelet? A platelet is a small cell particle. It's not a full cell. It's actually made from a bigger cell called a megakaryocyte, which you will not have to remember, but it's broken down into fragments. That is what, when you cut yourself, say you're cooking and you cut yourself, the platelets are the first things in the blood to go to that area to wall off the bleeding. That's why you don't bleed to death. If you didn't have platelets, you cut yourself, you just bleed and bleed and bleed and bleed. So what's in the platelets? A bunch of good stuff. But the restorative part of the platelet is pretty much here, this part up here. And it's going to sound a little scientific, but it's really not. You see growth factors here. So it helps tissue, damaged tissue, to grow back. Whether it's collagen, whether it's cartilage, whether it's muscle, whether it's other connective tissue disease, it helps it to grow back. And the only way the body knows how to heal is through what we call new blood vessel formation. The term of it is angiogenesis. So it actually mobilizes the body to make more blood vessels so it can heal itself. Okay? So that's a platelet. Keep that in mind. The platelet has all these things in it. Now, the platelets are produced in the bone marrow, and they come out into the blood pretty regularly. The normal person will have a platelet count of 150,000 to 400,000. They only last about 7 to 10 days in the blood because it's always churning out more. The body is taking it up, and then if it's not being used, it's pretty much filtered through the body's cleansing mechanism. Right, Dr. Sung?
Yes, sir.
Right? Okay. So, the platelets, what do? Tissue repair, just remember that. They repair from cuts to damaged cartilage, to damage to tendinopathies, tendonitis. People have chronic, like tennis elbow. They'll have Achilles tendonitis. They'll have, Baker's cyst behind the knee, or patellar tendonitis. This is an amazing treatment. You go to your doctor, a typical doctor is going to tell you, okay, I'll give you a cortisone shot. They'll pull up some cortisone and inject your joint. Now, acutely, in a short period of time, for about 7 days or so, the inflammation in that area goes down. But steroids in the joint actually is catabolic. It tears away your tissue. So long term, you don't want to keep doing steroid shots because all you're doing is depleting and depleting and depleting your natural cartilage and connective tissue. So you don't want to do that. But if instead you would do a PRP injection and take your own blood, spin it down, get the platelets concentrated, and inject it within, if it's a tendinopathy, within a couple of weeks, you're completely healed. And I'm talking healing. I'm not talking about a temporary fix. For knee arthritis, that's not bone on bone, we still have some cartilage there, we give it 3 months for it to be. I've had patients who come in with really bad joints and they can't walk, and after they've gotten the shot, they're feeling much better. We do a scale. We want to make sure that they're improving, and sometimes the changes are subtle, so you got to pick it up. But there's always some benefit. Okay? Now, the scientific people in here would like to know what type of growth factors that are in it. And these are the ones that you may or may not hear about. But tissue growth factor and vascular growth factor, those are the big ones that help to harbor those ingredients in the body to make healing take place. So the growth factors are here, and for the purpose of this talk, I will not go through what those are in terms of the name. It's not important. All you need to know as a patient is that there are things in the blood that's good, that we concentrate and we put in a particular area and we heal you. Right, Shay?
Yes.
All right. So does it work? You may say, I'm 85 years old. Are my platelets as good as somebody who's 25? So it really depends, a lot of it depends on your genetic makeup, how much platelets you're starting out with. I gave you a full range, 150 to 400,000, right? So the more you get concentrated, the quicker and faster you're going to heal. So it depends on a number of things. Total number of platelets, how much growth factors are in each platelet, and it varies with different patients. Some patients will get 5 times the concentration, and others will get up to 10. So I don't know that till we draw your blood and spin it down and apply. But you will get some benefit despite. And your platelet numbers tend to go down as you get older, but that shouldn't prevent, because most of the people that I'm doing these injections for are older people, and we're getting good results. So the growth factors, once we inject the platelets, it comes out, bam, and it says within 10 minutes, the platelets push out those growth factors, and they start doing their thing. 100% of the growth factors are released within 1 hour after the injection. 100%. And the healing takes place over a 3-month period. So you get the initial bulk of the healing within the first 30 days, but it keeps on working for an additional 60 to 90 days. So here's a graphic presentation of how you would prepare it. We draw your blood, we spin it down, and we would get the PRP, the platelet rich fraction, and then this is somebody with a tennis elbow. We would inject it into the joint. Does that make sense? Any questions from anybody before I go on? So am I using my platelets and putting into you, or am I using your own? No. I'm using your own. So what do you think the rejection rate of that injection would be? The body's ability to reject? 0%. Exactly. Right? Versus if you did stem cell from another human or a baby, baby stem cells are not as rejectable, that's the word, that can ignite a rejection response. Because they don't have all those antigens on it yet. They're babies. However, there's still a possibility of a rejection, right? And you don't want to use anybody else's blood products to go into you, except for red blood cells, and you have to have the same blood type for that, right? Okay, so another slide just showing you how the blood is separated. So now let's talk about some of the applications. Okay. As you get older, when you have surgery, there's a risk. There's a surgical risk. anesthesia. And seniors in particular, they'll have a bad syndrome after they go into anesthesia. And many people will die in an operating theater. I think you should at least try a natural remedy before you put people under the knife, right? Even for bad arthritis, before you do the knee replacement, you should at least try the PRP with the stem cell. So here it is. These are all the ways that we use PRP. I told you about the musculoskeletal stuff, strains and arthritis and tendonitis. But if you have a diabetic foot ulcer and it won't heal, diabetics don't heal quickly. We can take their platelets, inject it into the area, it brings about all the healing properties, and we can heal that ulcer. For dental implants I told you about, I have some amazing pictures. We have a laser practitioner who does a wonderful job with these anti-aging treatments. People with acne marks and melasma, and amazing. I'm going to show you some pictures that you're going to see how well their own body is able to heal them when you concentrate those healing factors. Okay? So it can repair any cell, including bones, tendons, ligaments, cartilage. I went through this. This is a slide on stem cell. And I wanted to just show you guys what happens when you get old. Stem cells have the ability to change into any other cell that's damaged, right? When you use your own stem cell, this is age up to age 10, 20, 30, 40, 50. You see what happens after age 10. Your stem cell population drops by about 90%. So that's why we don't really want to use your own stem cell when you get in these parts. They get older. So here's my first slide. You guys are going to become radiologists for a minute here. But what I want to point out is that you'll see this. This is a knee. This is a medial collateral ligament. You see this dark spot? That's a defect. This is a ligamental tear, this dark spot. The ligament's supposed to come this way. And when you look here, it's all filled in. The ligament has grown back on MRI. Medial collateral tear of the ligament. Completely intact. And that's after 3 months. This is an Achilles rupture. All right, let me orient you. This here is the Achilles tendon. It comes down this thing here. I'm going to block you guys. And with repeated injections, sometimes you need more than one. You see it's filling in to the point where it's completely healed. No surgery required. Injections of PRP. Completely healed. Okay? Now this is a 42-year-old drummer, so he's playing with his shoulders all the time. And he ripped up his rotator cuff, and he has a tendonitis from it, and you can see the difference over here to over here, completely healed. This is another person, a 34-year-old with pain in the elbow. He had PRP, and he had some amniotic fluid with it, and you'll notice the change in the thickness of the cartilage and his improvement of his tendinopathy. Arthritis, we can use it in arthritis, and we can use it for autoimmune disease. This is a patient that has rheumatoid arthritis and has systemic involvement. And it's an autoimmune disease where the body says, I'm going to start making antibodies to your joints, and it eats their joints away. But they can also get this rash. We can use stem cell intravenously and get rid of that and reduce the inflammation that exists in that disease. So rheumatoid arthritis, lupus, and autoimmune disease. Primarily we use stem cells for that, not PRP. Now let's talk about sex. Yes.
How about, have you used it in hip?
Hip joint injection?
Right.
Absolutely, yeah. Now the hip is a little more difficult to get to, but we do ultrasound guidance, so I'm able to pick up exactly where the hip joint is, and you know, it's a thicker tissue, so you have to get a deeper needle, a bigger needle to inject the PRP.
But it is possible.
Absolutely. They do it in the spine. They do it for people with cervical spine, and that's even more intricate. Cervical spine, lower spine arthritis, they do it for all of that, you know? Yes.
Is this typically one shot
For the PRP,
for a PRP? If you're, let's use the knee as an
I
example.
recommend 3 shots for a joint.
Over a period of time.
But for tendonitis, yeah, for over a period of time. 1 shot per month for 3 months. But if it's for tendinopathy, which is a tendonitis, just an inflammation, or you know, when 1 shot will work. But when you have a tear, then you need more. Any other questions? Sir?
What if you have bone on bone?
Bone on bone, then that's when you would require stem cell with the PRP to heal it. Because the stem cell, I look at it this way. Stem cells are like seeds. You go out and you plant a seed. The PRP is like the fertilizer that you put in on it. So the seeds are growing when you do the PRP, the growth factors. So it's like stimulating it. And I recommend 3 shots after stem cell too. 1 stem cell shot and 3 watering of the seeds is what I call it.
So it works on tendonitis.
1 shot.
Okay.
For chronic tennis elbow or patella tendonitis, or some people have an iliotibial band type of situation, wrist tendonitis, works wonders. 1 shot for those.
Autoimmune eczema. Does it work on this?
Eczema? Yeah, absolutely. It works. The stem cells is when you do something systemically, you have to put the stem cells. The PRP primarily is for injections, but then when you do stem cells, then you can get more systemic effect. I mean, total body effect. Yes.
Can this help in a situation where you already have had joint replacement, but it's nearing its replaced by date?
If you've already had a joint replacement?
I've had a hip replacement, and they say it lasts about 15 years. And I'm at about 10 years, and it's beginning to, I can tell it's starting to go.
Mm-hmm.
Or because it's already a fake knee, this wouldn't work for that.
No, you can't, it'll help with the inflammation around the joint, but remember, that's artificial,
Right.
made of some metal of some kind, so it cannot penetrate that, right? It's an inert object. So, but around the tissue, and if you have inflammation, it'll help with the inflammation. That's why I tell people not to get joint replacement, at least until they try this. Okay, so now we were talking about sex, remember? And you threw me. So, what is the O shot? This is with PRP, by the way. We take your blood the same way we concentrate the platelets, and we inject it. It's painless. Painless. I gotta keep saying that because when people think of that part of their body, they're like, huh? We inject it around, I mentioned earlier, for urinary incontinence, we inject it around the urethra, and that actually mobilizes collagen and connective tissue to help with that leakage. Great results with that. And then, for the enhancement, because as we get older, the sensation, the sensitivity in the clitoral hood, and I'm using medical terms here, becomes less sensitive. So the platelets once again, it generates that, okay? So it's not like a screen cream, if anybody ever heard of that, or the G-spot or anything like that. It just allows it allows that area to be more sensitive. Okay? Does that make sense? So that's that shot. And it's a good shot. We've done several of those. My wife also does them. Now the P shot for men, obviously if we have something for women, we need to have something for men. So the P shot is called the Platelet shot. It's named after the Greek god of virility, right? So that's where they have Platelet. That's his name, virility. What we do with that, and once again, it's a pain-free shot, right? Mm-hmm. We use creams. And really, then I do a digital block, which is we block the pudendal nerve and you don't feel a thing. I've done a whole lot more of those than I've done the O shots. But because as a man gets older, there's circulatory. If you smoke, if you have diabetes, if you have high blood pressure, the circulation to that particular part of the body really shuts down, and it really can create a problem with dysfunction. Okay? So diabetes is probably the worst thing that kills a man's circulation. He should not have diabetes. Otherwise that part of your life would be over prematurely. So this is cutting edge. And we do shots along the shaft, and it goes in there and it actually grows new blood vessels so that blood can get into that area again and work better. It's called a P shot. Right? You can read about it. It's been published, and it works great. You go to any men's clinic, this is going to be one of their biggest things that they do. But I do them here.
I have a question.
Yes.
And is that also a one-time thing?
That's a one-time shot.
Series of shots.
Yeah, but it's one day you come. It takes about an hour. How long does it take to prepare the PRP?
It's 30 to 40 minutes.
30, 40 minutes, and it takes me probably 20 minutes or so to do the full injection. Okay? So, you have to talk about sexual health because it's a part of life. And, many people are not enjoying their lives the way they should because this part is sour. All right, now, this is dramatic. Male pattern baldness, otherwise known as androgenic alopecia, or alopecia from stress. People lose their hair. But men, if we build up our testosterone and our DHT, will cause this kind of baldness in young people and in older men. This is after, if he was here, I'd have him come up and take his hat off. He's not here right. But amazing results with this particular injection. These are injections. Lisa, how do you put the PRP in the scalp? Just kind of tell me.
My needle
Yeah.
has 9 little needles, and they inject so I pour the in.
Amazing. This is like a facelift. You can see how much all the wrinkles here and down here compared to after she's had. This is one treatment.
Well, that's 2 treatments.
2 treatments. Oh, that would be that, and this would be that. Without any knives, you didn't have to pull, stretch the face back. You didn't have to do any of that. This is just with her own platelets. Her own platelets is done it. Because of the collagen, the growth factor stimulates that. If it's damaged, the body knows. Something is damaged, it's going down, it's degenerating. Let's mobilize what we need to mobilize and get it fixed. This is a young lady who has, basically, this is androgenic. Her testosterone level was on the high end, and she got a lot of acne from it, because testosterone can cause acne. This is one treatment.
Yeah.
This is
and
one
then
treatment. You
2
can
weeks
see
after, so she's still healing.
she's still here.
Yeah.
This is a lady who was born with melasma, and these dark spots just come on dark amber type of spot. I'm not going to color it, but it's a discoloration on your face. And she's been getting PRP treatments to heal it. And you can see there's a difference. She's not over yet, but we're treating her. How many treatments will she need, do you think?
Probably 6.
Okay. And here's another kind of facelift. She did this down here. You can do the neck, the whole face and neck. She looks a little better, right? So, like I said, my talk is going to be short. I didn't want to bore you guys with all the science, so I skipped over a lot of that. But regenerative medicine is here. You have genetics. Now we're doing, everybody, you need to know your genetic profile, what risk, what disease you're susceptible to, right? We're screening for a lot more diseases now, right? We want to try to pick up cancer early. Regenerative medicine is a way, as you grow older, your body wears out, and we want to fix it without them cutting on it, without surgery, without steroids, without a lot of drugs. This is all natural treatment that really has been amazing. We've had amazing results here at the Regenerative Center. And I strongly urge you guys to consider it if you have any of those conditions. Okay? Many uses, and they're still finding more and more uses for it. So it's a great thing. And without... Okay, here we are. We have a PRP. You want to come on up and talk about that? This is the special that we have for you guys because you're here tonight. We have a special. But any questions for me before I step down?
So if I have, let's say, a meniscus tear, I have arthritis in my shoulder, and I have hair loss, that's 3 different shots.
3 different areas.
3 different areas. So you don't have one to treat all on
That would be systemic stem cells. And the price of that is very, very high. But that's a good point. It's a good point. My brother, you got a question for me?
No, sir.
You've only heard me talk about this stuff all the time. Ms. McEwen? I know most of you guys. You do. These guys are news. Welcome. All right. Any other questions before I step down?
I got one, I guess.
Yeah.
What about stiffness? Does it work with stiff
Stiff
neck, like a stiff neck?
Stiff neck?
Yeah.
Is it from a tendonitis? It'll work.
Yeah.
Okay. It'll work.
Okay.
Like old injury stiff.
Yeah.
Well, you got to regenerate it, right? I'm sure you've had chiro and all of that stuff.
Yeah.
So, if you have arthritis, degeneration in your cervicals, that's not something that you could do, but it's something that can be done to help.
If you have cervical osteoarthritis,
Right, degeneration from
degeneration,
osteoarthritis.
yes, you can do the injections inside that disc space
Okay, and that's
under
not,
ultrasound guidance or CT guidance.
is that something that you would do, or
I
someone?
wouldn't do it on the CT guidance. I have an ultrasound machine. I could do it under ultrasound guidance.
Okay.
I would.
Speaking of that, is that a one-day, it's not a surgery, right?
You can go to work the next day.
Oh,
Yep. And all of these procedures, none of them will take you out of work. None of them will cause you to have significant morbidity, and definitely no mortality. Yeah.
how long does it last? One injection, one
For
treatment?
what? Particular, everything is different. For what? For what area?
Let's say OSHA.
The OSHA. There's a doctor in Alabama who obviously somebody has to discover it, right? So he recommends one shot, and you wait for a full year. If everything is good, then nothing. But if it should recur, if you feel like something is not right again, and you need to do it, you do it one more time. Is that okay? No more than 2 for the ocean.
So what about the acne shot? Like, where do you inject that? Do you inject in the face?
So we have the laser, the esthetician, the laser practitioner. I don't want to say it wrong.
Yes, you
Yeah.
can do it in the face, wherever you have.
But it's numbed up.
Mhm.
Yeah.
So what's the vampire
Discuss.
facial then? What is that about?
Again, it's the injections in your face, it's all over your face.
Oh, okay.
Yeah.
Yeah, that's what it gets rid of all
I
the.
had a vision of blood smear on my
That's why they call it the vampire facial, because you do have little blood spots, a little bit, but it goes away within.
Yeah, you do bleed from the, the little needles, but you don't feel it between on you.
All right, so at this, okay.
When with the arthritis, it doesn't work for everybody. Some procedures don't work as well in some
If you have
cases.
normal genes, yes.
Oh, so that leaves me out.
But if you're an alien, I can't tell you. It works for everybody that I've done it on has seen some improvement. Some people 100%, some people 90%. All right, so this is the part where you clap and clap loud.